Good morning, one and all. I am Dr. Yogendra Pawar, going to discuss about the seminar topic Cultural Care, a historical perspective for the submission of assignment online refresher course in Global Studies UGC HRDC Dr. Babasaheb Ambedkar Marathwada University Aurangabad. Friends, while we focus on cultural care, we have to develop a particular perspective, that is historical perspective towards the cultural behavior. In regards, we can discuss about this trans cultural nursing, cultural awareness, cultural blindness, the knowledge of various cultures, community based nursing, and accept this, we have to know the meaning of culture. While we discuss about the meaning of culture, it refers towards that culture refers to the beliefs, values, and behavior that are shared by members of a society, and it provide a design or map for a living. It is the culture that tells people what is acceptable or unacceptable in the given situation. It is culture that discuss or that dedicates what to do, what to say, or what to believe. It means the situation which is created by the culture, the aspect includes into the culture that are learned by a particular person, into which cultural diversity, also called cultural plurality, means that a variety of cultural patterns coexist within a designated geographical area. It is belief and feeling that one's own culture is best. It reflects our tendency to judge other people's beliefs and behavior using values of our own native culture. Discrimination, differential treatment of an individual due to minority status, actual and perceived. Example, we just aren't equipped to serve people like that. The cultural imposition, belief that everyone should conform to the majority. Example, we know what is the best for you. If you don't like it, you can go elsewhere. Friends, we also have to focus the characteristics of a particular culture. Anthropologists, sociologists have made significant contributions to the field of community health. According to their findings, shed light on why and how culture influences behavior. There are five characters shared by all cultures are especially parental or it improves the community health. The first is culture is learned. The second is culture is integrated. Third is culture is shared. It is shared, it is taxic, and the last one is it is dynamic. While we discuss the first characteristics of the culture, that is culture is learned, we can gain some information, that is the pattern of cultural behavior as accepted, not inherent, rather than being genetically determined. The way people dress, why, what they eat, and how they talk are all learned. At the moment of birth, we lack a culture. We don't yet have a system of belief, knowledge, patterns, or customary behavior. But from that onwards, moments until we die, each of us participates in a kind of universal schooling that teaches us our native culture. Laughing and smiling are genetic responses, but as infant, we soon learn when we smile, when to laugh, and when how to laugh. We also inherit the potential to cry, but we must learn our cultural rules for when crying is appropriate. We can rightly discuss that the culture is integrated, being merely an assortment of various customs and rites. A culture is a functional, integrated whole. As in any system, all parts of culture are integrated, are interrelated, interdependent. The various components of culture, such as its social modes or religious belief, perform separate functions but come into relative harmony with each other to form an operating and cohesive whole. In other words, to understand the culture, single trait should not be described independently. We can explain it about that. Each part must be viewed in terms of its relationship to other parts and to the whole. In some cultural groups, modesty for women may make it uncomfortable and perhaps traumatic to be examined by a person of the opposite sex. The next characteristic is that culture is shared. To enlighten these characters, it is assumed that culture is a product of aggregate behavior, not individual habit. Certainly, individuals practice a culture, but customs are phenomena shared by all members of the group. Culture does not depend on individuals. An ordinary habit dies with its possessors, but a group habit lives on in the survivors and is transmitted from generation to generation. Moreover, the individual is not a free agent with respect to culture. He is born and reared in a certain cultural environment which impinges on him at every moment of his life. From earliest childhood, his behavior is conditioned by the habits of those around him. He has no choice but to conform to the folkways current in his group. While we discuss about cultural modesty traits, culture provides a guide for human interaction that is tactic, mostly unexpressed and the unconscious level. Member of a cultural group without a need of discussion know how to act, what to expect from one another. Culture provides an implicit set of cues for behavior, not a written set of rules, because culture is mostly tactile. Realizing which of one's own behaviors may be offensive to the people from other groups is difficult. It is also difficult to know the meaning and significance of other cultural practices. Touching or calling someone by their first name may be viewed as a demonstration of caring by some groups, but it's seen as disrespectful, offensive by others. And the last point, which is characterized by the culture, that is, culture is dynamic. Every culture undergoes changes, none is entirely static. Within every cultural group, some individuals generate innovations. More important, some members see advantages in doing things differently and are willing to adopt new practices. Each culture, including our own, is an of ideas, values, practices from a variety of sources. This process depends on the extent of exposure to other groups. Nonetheless, every culture is in a dynamic state of adding or deleting components. Functional aspects are retained, less functional ones and are eliminated. While we think about the some transcultural assessment model related to the culture, that is the Lineker's sunrise model, that includes the points that the greater the difference between folk and professional care practices, the greater the need for nursing care accommodations. It is totally based on the healthcare of a community or culture. So, friends, while we think about the culture, these aspects are very helpful to think over the cultural aspects or cultural care from our side, and it helps us to understand the cultures of other community also. Thank you.